Good afternoon, everybody, and welcome to this meeting of the Public Services Board. We'll go straight on to our agenda items, and the first item is welcome and apologies for absence. Alison?
Yeah, thank you, Chair. Apologies from Amanda Carr for today's meeting.
Okay, those are noted, and we'll go to item 2, any disclosures of personal or prejudicial interest. Can't see anybody indicating. So we'll move on to item 3, the minutes of the previous meeting. Is everybody happy? I haven't had any notification of any changes. Are we all happy that they're a true and accurate record? Yeah, we could see lots of nods on screen. Thank you. And so we'll go then to item 4, public question time. Alison, have we had any questions from the public, please?
No questions today, Chair.
Okay, great. And so we move swiftly on then to item 5, updates on the 8 steps in our Public Services Board Action Plan 2024-25. And I'll go straight to Karen Stapleton from Swansea Bay University Health Board to give us an update on the transforming early years services across Swansea. Over to you, Karen.
Thanks, Chair. So most people who on this call will be aware that Swansea Bay's got the lead on behalf of the Partnership for Early Years. And one of the aspirations set out in our steps has been to agree a set of strategic principles for early years to support us integrating the early years pathways across agencies. We've had some difficulty in taking us longer than we'd hoped to do that, and colleagues are aware that is because we're trying to do this across the Health Board footprint and work with Newport Talbot as well. So I'm really pleased to say that in December, before Christmas, we managed to get a set of principles about how we're going to work collaboratively together agreed. And I think in Swansea and in Newport Talbot equally, we've already started to use those principles to try and inform how we work together. And if I can sort of give an example of one of those principles, it's around executing our work together based on high quality evidence and insights with a focus on prevention. And an example of what we're doing between us and our Flying Start teams is we're using our shared data. So we're using the local authorities, lower super output data, using data that's coming from health visiting to really, by layering that together, we're really starting to use that to inform the expansion of where we're going next with the Flying Start. So that's an example, I think, of how, so we could have done that without these principles. But these principles mean that we're really going to be using that data, for example, really focusing on the needs of families. And I think that's an example of how we're using that to start to transform services to benefit. I think by February we'll have 175 more children and families, and the plan is then to sort of focus then. So the health visitor data is putting an extra layer to what the local authority have to help us then go next. So I think that's going to inform the next stage. So that's an example of what we're doing there. We've got a regional senior management board now, which is so people like Jane Whitmore from the local authority and her equivalents in Newport Talbot. We are overseeing then the work that the operational teams are going on the ground. So we're trying to inform the work they're doing. In our next workshop, which is being hosted by Newport Talbot in a couple of weeks' time, multi-age, which we're looking at the multi-age high-level pathway, and we're hoping to come up now with a high-level draft pathway for early years that we can all sign up to together. So we can then go out and start to consult on that, and then use that as our teams on the ground to start to focus where we need to go in that really important early years pathway. So I hope that's covered off the updates on step 1. I'm happy to take any questions.
Thank you, Karen. And it was remiss of me not to welcome Abigail Harris, CEO of the Swansea Bay University Health Board, and also Marie Davis to the meeting, Executive Director of Planning and Partnerships. Welcome to you both. Thank you, Karen, for the update. Just to go to the board members, does anyone have any questions on step 1? No? Okay, thank you for the update. That's appreciated. And we'll move on then to building on Swansea as a human rights city. And Ness, I'll hand over to you.
Thank you, Chair. So Swansea's work as a human rights city is moving forward. We've made some solid progress in the last quarter. So key updates are in terms of the fire service, they've now introduced training on spotting signs of poverty and connecting people to the right support. They've embedded that training into their community safety programme. In terms of the SCVS, they've delivered 13 safeguarding courses and secured extra funding to expand that support. And they're also consulting with organisations to make sure, that funding goes where it's needed most. So good progress there. In terms of the Health Board, there's a push to weave human rights principles into the Health Board Strategic Equality Plan, and that plan is still in development, I understand. In terms of public engagement and awareness, a human rights newsletter went out in December sharing stories about community events like World Children's Day, a winter welfare initiative, and projects giving people on probation a voice in shaping policies. And we also ran a big survey at the end of 2024 to measure public awareness of human rights issues. We introduced a youth version, and more than 50 children took part in that, so good to see. We've established our stakeholder panel, so the group includes human rights lawyers, and it met for the first time in December. And they're now looking at how Swansea compares to other human rights cities and exploring opportunities for collaboration and learning exchanges. So in terms of the next period, we're going to keep rolling out training and the safeguarding initiatives I mentioned, hoping to see the final version of the Health Board's plan with human rights principles embedded within it, and we'll use the insights from the survey and the stakeholder panel to inform our future plans and projects. So overall, things are moving in the right direction. Still work to be done, of course, but all taking us towards having human rights fully embedded as part of Swansea's services.
Okay, thank you very much, Ness. Got a question from Abigail.
Yeah, thank you. I was just going to make a comment in relation to the Health Board's strategic equality plan. That is still in development, but it is due to come to our board on the 31st of March. So we'll take that back, Ness, into the organisation and make sure that as part of that development that we cross-reference this across, because this is really important agenda for us. So really keen to make sure that we reflect this action in that plan. Happy to pick that. Great. And just a question, I'm interested to know which other cities we are kind of peering with. So apologies, it's a question about knowledge, really gaining more knowledge. Where are there other human rights cities that we might want to link in with?
There aren't any in the UK, but there are across Europe. So we'll get you a briefing, Abby, to give you some of the detail on that. But we are leading the way, really, in the UK in terms of being a human rights city. And our team attended a UNESCO conference recently, and we spoke about the work that we're doing here in Swansea, which was really great.
Okay, great. Any further questions for Ness? No, thank you, Ness, for the update. So we'll move on to working towards Swansea's net zero target and nature recovery. And I believe Jane Richmond is taking us through this item. Jane, over to you.
Thank you, Chair. Yes, so in the last quarter, we've started to make some progress again on the mapping exercise. We looking at collaboration opportunities and where we've got commonalities. That did get a little bit behind due to resource issues within the partner group, but we're now managing to make some good headway on that. The adaptation and mitigation strategy, the technical report came in. And we are now at this moment in the process of commenting on the second draft of that. This will come to Public Services Board next week, and we will be asking for a couple of weeks for partner members to comment on it. It's a technical report, so this is basically an evidence report looking at all the legislations, how we can tie in with the different legislations, obviously, and including the fact that the Welsh Government have just released their climate adaptation strategy themselves, but also look at the outcomes from the workshops and to make it a really a Swansea document, and what the partners and the communities feel were really important for us to take forward. So would really appreciate it if I can send it to Leanne next week on a WeTransfer. There's quite a lot. It is quite a weighted term with a number of appendices, but hopefully it's not going to be too much of an onerous task for you. So I was just hoping that it would be okay for you to be able to read through it. If you could have a couple of weeks to do that and to comment, and we're going to send back a collated response from everyone to the consultants for them to do the final draft. As I say, this is the technical report, this is the evidence report. Then once we've done that and it's been agreed and everybody's happy with what it is at the moment, and we have looked at what everybody feels that we should have looked at, then we will move on and do the draw up the strategy and the outline action plan, which we will obviously be bringing back to PSB in due course.
Thank you very much, Jane. And I know you've put an incredible amount of work into this, and it's really very much appreciated. So we look forward to seeing that coming forward. Any further questions for Jane? No? Okay, that's great. Thank you, Jane. And thank you as well to Howell. So we'll move on to making Swansea safer, more cohesive and prosperous. And I think we've got Roger Thomas with us for this item. Over to you, Roger.
Great, thanks, Chair. And great to hear from Ness earlier around the way in which we've linked up organisations. I think some of the observations, shall I put them as obliquely as that, around PSBs have been sort of some of the work and some of the outcomes and outputs that we've been able to deliver. So to be able to link up, disparate groups that may not have picked up some of this thing. So Ness makes reference there to our community safety work, going out and being the eyes and ears in communities and be able to not pick up and deliver sort of interventions directly, but to signpost into other organisations. I think it's really positive and from my perspective, a sign that we are doing things more cohesively and collaboratively as well in that space. So really positive. So thanks for that, Ness. So three sort of separate elements to a three-pronged attack, really, in terms of our work around making Swansea safer, more cohesive, more prosperous. The first one was, it seems a long time ago, was last June. So was the event we ran. Just for those perhaps who not got the background information, there's the Welsh Firefighter Challenge, which is run every year, sort of a series. Imagine It's a Knockout, but with fire kit on, that type of sort of thing. That type of event, sort of running out, doing sort of practical exercises by the clock, and we attract teams from all over the UK and internationally as well. Really, it's our second year that we've run it. Third year. The second year in Swansea area as well, again, and it's growing by the year. It's really, really positive. So what we tagged on to the side of this event, knowing that we're going to have a lot of footfall and people coming along in the middle of June, was a community safety village. And again, thanks to all the partners who got involved in that. A number of them on the call today. So really positive in terms of that wider engagement about prevention and identifying how we can, in the spirit of what Ness has just highlighted, the join up disparate organisations perhaps and see how we can cross-fertilise some of the learning as well. So again, really good engagement, a fantastic opportunity to push out some of the key prevention messages, because we know that if we can stop things happening, that's far more beneficial to us moving forward in terms of reducing demand on our ever diminishing services as well. So that's been really positive. It is our intention to run it again this year. So Chair, I'll be looking to Swansea City Council to support us in terms of the event. On a wider scale as well, and these things are booked up a couple of years in advance, what we'd like to do as well is to make it bigger in a couple of years' time and go for the British event, which is a really, really significant thing. It would draw a lot of footfall into the Swansea area and again, I think assist in terms of putting Swansea on the map, run over a weekend, but it would mean a lot of sort of engagement with the team at Swansea City Council in terms of management of roads and the likes as well. But that's something we're looking to plan in a couple of years' time, and a bigger community safety village as well, I think, would on the side of that, really positive. The second then is in and around our targeted prevention workshop, which we ran at the Liberty Stadium, the Swansea.com Stadium, back in November. And again, we had a sort of themed workshop style event, a number of keynote speakers in and around safeguarding, hoarding, poverty action as well. So some really good, and a lot of not only specialists in the field, but some sort of we had a number of people impacted in terms of some of the poverty work and inclusion work as well. So it was good to hear sort of those voices from the ground, if you like, the people who are on the sharp end of receiving some of this support as well. Were really granular stories, and then a number of sort of breakout sessions that we ran as well. Again, really well received, and some great positive feedback. Some challenging feedback as well. I got to say, in interest of balance, I think it's important to note that certain things didn't land particularly well. But again, not to shy away from some of that challenge as well. So we take that on board. We will look to do a similar event again, I think, this year. Again, another theme, and to extend some of that work as well. So, and the third piece then, I'm sorry that Amanda's not with, Amanda Carr, who leads Swansea CBS, because this was her piece of work, and she's looking really to develop a campaign regarding diversifying funding sources, and in and around opportunities through individual organisations' payroll, and the way in which we procure services. Are we able to do that through, you've probably seen it, possibly through Amazon, where you're able to identify where you purchase things, and there's a sort of percentage will go to a good cause or that sort of thing. So that's the sort of mechanism that Amanda's looking to set up. It's in its infancy at the moment. Amanda hasn't moved a lot of this on, but it is in there as a sort of art of the possible, I suppose, as well. But I'm sorry Amanda's not here. She would probably give a little bit more information in terms of the sort of progress in and around that as well. So yeah, so that's where we're at. Happy to take any questions, observations, and as we do come out for an ask for either attendees at a community safety village or the whatever event we plan, a themed event, we're looking to members to really get involved in that as well, as you have done in the past. So yeah, thanks, Chair.
Thank you, Roger. And the UK event sounds extremely exciting as an opportunity, and we always welcome further footfall into the city centre, as you know. So some really positive updates there. Does anyone have any questions for Roger on this item? No, thank you again, Roger. So we'll move on to the step, developing Swansea's integrated cultural offer, and I'll hand over now to Mark Wade to take us through that.
Thank you, Chair. Afternoon, all. Quick update from me. Main activity has been around the development of the cultural strategy. Just so that everyone's aware of what we're actually trying to achieve there. It's a strategic document that's really wanted to spell out the cultural identity of the region, and be drawing on our ability to sustain and generate opportunities for growth. And that may be around things like arts and culture, but also the creative economy as well, and creative network, and things like special events, which links nicely into what Roger's indicated there. I think are an important part of that, and maybe not necessarily what you think of as being culture, but it quite clearly is, as well as sort of tourism and marketing and sports and well-being as well. So in terms of key activity, much has been around the development of the strategy. Is on target to be developing a draft by the end of March this year, and we're taking some advice currently around the extent of further public consultation that's needed on that, and we'd certainly want colleagues and input from the Public Services Board through that document as well. So watch the space on that one, and we'll certainly keep the PSB informed. Going onwards then, in terms of our interaction with Sport Wales, and how we are funding sport and health activities currently, that's going through a period of change at the minute, and a new regional partnership model is being established with Sport Wales currently, and that's being the governance arrangements for all that are being consulted on and established currently. So at the moment, I'm advised strategically the delivery of that is planned for, finalising it is planned for April of 2025. Shouldn't affect anything operationally, but just understanding that new arrangement currently in terms of delivery of our sport and well-being offer as well, aiming to increase levels of participation and general health and well-being currently across the city and county at the moment. So in terms of my update, that is it, Chair. Thank you.
Thank you, Mark. Any further questions for Mark? No, appreciate the update. So I won't read them out in their entirety. Steps 6, 7 and 8 are with you, Ness. So over to you.
Thank you. So, Chair, these are the ones that are slightly less exciting than the other 5 that we've covered. So the first step, step 6, we've actually got a report on the agenda in relation to that, item 6. But it's the governance arrangements step where we are seeking to strengthen the connections and sort of more fully align the governance structures, partnership structures across the region. And so the actions here were to undertake a mapping exercise, which we have done, and the aim of that was to clarify roles, avoid duplication, and to try and streamline decision making across some of the strategic partnerships that we have within the county and at a regional level. So that report has been prepared and it's on the agenda. Actually, it has been circulated to the other partnerships for consideration, and so I won't go into more detail on that now because I'll be talking about it again in a minute. Step 7 is about improving data quality and accessibility, and the primary objective for 24-25 was to develop a digital data portal for the partnership for use across the Swansea Bay region in collaboration with Data Cymru. And so since the last update in October, we've been working closely with Neath Talbot and Cymtaf PSBs as well. We've consulted stakeholders and have been working with Data Cymru. And so we've agreed on 8 high-level themes with 80 to 90 indicators covering areas of children and young people, environment, health and well-being, community safety and resilience, employment and income, culture and heritage, housing, and demographics. So the portal is actually being funded through the 24-25 regional support grant. The cost is around 8,000 per PSB, with ongoing maintenance of just £1,000 a year. So we signed our contract in early February, and once all of the PSBs are signed, Data Cymru will start development, and it's anticipated that that'll be ready by the end of March to match the funding deadline. So Data Cymru has secured 90% of the indicators we asked for, and we'll review any of the measures that we asked for that are missing in the next financial year. So we're hoping to have a demo of the portal for the informal PSB before the end of the financial year. So turning then lastly to step 8, which is developing the PSB's performance management arrangements. So this step focused on establishing mechanisms for monitoring well-being and outcomes as a population level. So you recall last year it was very much focused on how we performance manage our actions as a PSB, hence the action plan and the updates we're providing here. But this year was about going a sort of at a higher level, looking at our population well-being outcomes. And so we've worked as part of a regional data group with our statutory partners to develop a workbook of key indicators aligned with our wellbeing plan. So we've shortlisted 2025 indicators, and those are the ones that we agreed that we'll monitor annually with quarterly reports covering 5 to 6 indicators at a time. So I'm hoping that we'll be able to present the first report covering the last quarter of this financial year. The report will come to the PSB in the first quarter of 25-26. We're developing a dashboard with tables and graphs to track national and local trends. And once obviously we've got multiple quarters of data, we'll be able to conduct an annual review once we've done 12 months to ensure that those indicators that we've selected remain relevant. So, all of these 3 steps are really about enhancing, our ability to track our progress, share insights and inform our decision making, and really build on some of the comments made to the PSB by the scrutiny committee in previous years, and they've really helped us to sort of drive improvement in this area. So I want to thank everybody that's been involved in the work to date, and look forward to continuing that collaboration as we implement these changes. I think for me, as we look forward to 25-26, we might want to reflect about whether we need all of these 3 steps to go forward, or whether we have now concluded what we were seeking to do in our wellbeing plan in relation to these areas. Happy to take any questions or comments.
Thank you, Ness. And I'd like to add my thanks to all involved, and particularly to you as well. This might not be, as you say, the most exciting on the agenda in terms of steps, but it's absolutely critically important that we analyse the data and we find out what the outcome, the impact the PSB has had in terms of our partnership working, and that's really critically important. And also, I'll probably talk more about item 6 when we come to that step. So I've got Abigail and then Marie.
Yeah, thank you. And I'm just picking up on the data point. So it's really pleasing to see that, because I guess the whole point of this is being able to track that we're making positive progress in terms of outcomes for the citizens. And just to welcome that and do anything that we can to support this, because I have been interested to see how well we are, not specifically around the PSB, but how well we're using our data to really draw insights in terms of outcomes for our communities and populations. And I recognise that in Health Hub we've got some work to do on that as well. And I welcome the interface with the RPB on this, because I think one of the things that we've struggled with is not having one set of the data that we're all working on. So we seem to have different data sets for different things. That doesn't help us. So that sense of we've got one version of the truth that's giving us a really good sense across the partnership and across into the RPB for those metrics that relate and overlay with the RPB. And so for us, things like the unscheduled care system and how we're getting people back home safely and keeping people well at home is a really important part of the preventative piece. So happy to pick up any comments or questions, but really welcome that work. So thank you.
I think that absolutely is why we embarked on this piece of work, because we recognised that all the partnerships are contributing something to these population level outcomes. And so even though you can't necessarily quantify what each contribution is, at least if we are all looking at the same set of indicators and measures, we can show that globally we can see the contribution that we're making to them. So absolutely, that's at the heart of the kind of role of this. And health colleagues have been involved in this step. So the measures that we've come up with, and we hopefully we'll have something, as I say, in the next quarter to share, will reflect what you are doing and what the Regional Partnership Board is doing as well. Fingers crossed.
Thanks, Ness. Marie?
Thank you, Chair. Thanks for that, Ness. Being a newbie, I haven't quite got all of my ducks in a row in terms of papers for this meeting. So I've got papers for step 5, but not for the rest of it. So did you share the dashboard, Ness, as part of this update? With them? No, you haven't. Okay,
it's in development, the dashboard. It's not
right.
It's not available as yet. So
okay.
It's something which we will bring. What we tend to do in this PSB is we have a formal meeting, and then every 4 months, and in between we have an informal face-to-face meeting. And so when things are in development, we tend to bring those to the informal meeting and then bring it to the formal meeting when they're ready to sign off. So the next informal meeting is where we'll have some of that detail.
That makes a lot of sense. And just for information, we're about to embark on a bit of a refresh of the Health Board's strategy, and one of the things we want to strengthen are the clarifying some of the outcomes that we're trying to achieve for our population. So making sure that there's good alignment, I think, with what we're trying to do as a whole system for our citizens is really important. So it's really timely, I think, for us to be able to make sure that we've got at least consistency in terms of how we are aligning our measures in that respect. So having a dashboard that looks the same, looks at some of the key contributors to some of the bigger system deliverables is going to be really helpful. So I think this is great timing from our point of view. Thanks, Ness.
Good.
Okay, great. I can't see any further questions or comments on these steps. Thank you for the update, Ness. So we'll go on to item 6, which is the Swansea Public Services Board review of partnership governance. Back to you.
Sorry, me again. So very briefly, you've got the report in your pack, but basically this was the report which the team put together, which evaluates the governance structures across the region. So focuses on the Public Service Board, the Regional Partnership Board, the Area Planning Board, Safer, and the Safer Swansea Partnership. So it identifies a number of areas of overlap, gaps in coordination, and potential opportunities for improvement. So for example, the PSB and RPB are both looking at health and wellbeing, potentially leading to duplication. The Safer Swansea Partnership and the PSB Strong Communities Group are both focusing on community safety. So there's a number of, you can see very quickly that there is potential for overlap and duplication. There's also multiple partnerships holding similar quarterly meetings, which is really challenging, especially for some partners who are having to attend more than one of those. There are gaps in coordination and data sharing, some of which we've just talked about, and some of the sort of more strategic areas are lacking alignment. So things like climate change, perhaps what we're doing as individual organisations or partnerships isn't perfectly aligned. The other element is digital transformation. So we're all doing a lot on digital transformation, but perhaps our efforts could be better integrated or aligned to make more use of the shared resources that we have. So the recommendations in the report are about how we leverage existing groups for coordination. It's not about setting up another layer, because I think we all agree that if anything, the landscape is already very cluttered. But also about perhaps designating the PSB or the RPB as the main coordinating body for some of these overlapping issues, perhaps identifying standing agenda items, enhancing some data sharing mechanisms, which we've already started to do, of course, and improving the use of existing IT systems to potentially help us collaborate more seamlessly. So there's a number of recommendations: maximising the use of digital tools, promoting the adoption of shared digital platforms, where we've just talked about the data portal, and that'll be useful in that regard, aligning meeting schedules, and developing shared calendars so that we can prevent scheduling conflicts, because quite often the PSB might be doing an event and the RPB is doing something similar, etc. Some of these things are quite low level, sort of housekeeping issues, but some of them are much more potentially strategic if we take that opportunity. So the report has been sent to the different partnerships. And Leanne has had discussions with colleagues in each of those, but as yet we haven't had formal responses. We did have a response today actually from the RPB saying the kind of formal endorsement of the recommendations plan is on its way. It just hasn't reached us yet. But certainly the RPB's agenda around reviewing their governance in terms of reference is very much aligned to the content of this report. So it's brought here today, I guess, just to raise its profile, given that it was circulated back in November, and to say we are seeking that broader endorsement from the region, and we'll bring further feedback back once we've had those responses from all of our partnership partners.
Okay, thank you, Ness. And again, a really critical piece of work. There's nothing worse than duplication and gaps in systems, and this is a perfect opportunity for us to work more closely and more collaboratively and be more joined up in our approach. So some real opportunities, as mentioned in the report. So I'll open it up for any questions or comments. Everybody's had this in advance to look through it. Marie?
Yeah, thank you. This was the paper I've had a chance to have a look at and have a read of. and there's lots in there that is absolute common sense. There is a huge amount of duplication, certainly between local authority and health. So we often see lots of the same people. I mean, I'm new to Swansea, at Swansea Bay and Neath, Port Talbot and Swansea, but certainly already I'm seeing lots of the same faces, but with slightly different hats on. But we also have colleagues here that we wouldn't have around the RPB. So it is, how do we get, so I think the principles are fine. The action seems sensible. I think the reality of implementation is probably going to be more complex than it looks on the paper. I'm not sure what the hierarchy of decision making is, who trumps who, and then how we make a decision to, you know, if we're saying that we want to merge groups or some boards or some, you know, I know there is a there are other parts of Wales that have done this. So there's obviously a format that we can, you know, that a record that we can adopt potentially. So I think what I'm trying to say is the principles absolutely fine. Just making sure that we don't throw the baby out with the bathwater, which seems to be my favourite phrase of 2025, is going to be really important. But in principle, very supportive. I think the devil will be in the detail, but happy to be part of that process.
Thank you, Marie. Abigail?
Yeah, thank you. I found this really helpful because I have to say that 3 months in, I was struggling a little bit to understand quite how everything fitted together. And although I've asked Karen numerous times and asked various questions, seeing it all laid out like this is really, really helpful for me. And I guess one of the things that we will need to work through is how we absolutely link into some of these areas that might need to give a sharper focus. So if I give an example, you know, coming in fresh and looking at the priorities in the health board, I am concerned about our mental health services. Not that our people aren't doing really brilliant things, but the facilities in which we're providing services and probably the models of care need to be looked at. And I'm really concerned about the death by suicide rate in our population, and a sense that we need to be looking at that with more urgency as a collective partnership in terms of outcomes for our citizens. And I've commissioned someone through the health board to come in and with a sort of an expert external lens to help us shape and develop our mental health services. And they'll want to be talking with partners as well, because clearly it's an agenda that very much requires partnership input. And just looking through this, I'd be thinking about where does that fit in. I'm not entirely sure in terms of what we'd be looking at that it would fit neatly under the area planning board, although coordinating mental health and substance use is in there. But it's just for me kind of overlaying where the health board needs to take some of its kind of partnership agendas when they could sit in more than one place. I guess it's the point that Ness and Marie are both making. Where do we make best use in terms of really overlaying and reaching into some of these partnerships? And I guess it'll take a bit of work, but in principle, I'm really happy to support the recommendations, because I think it can be a bit confusing. And for me, it's if we can simplify it in any way that we can, that would be great from the health board point of view.
Thank you, Abigail. That's really helpful and really positive, and we look forward to working with you going forward. Absolutely. Karen?
Thanks, Chair. I was just going to add that I think the area that we're working in around children, young people and families is an area at point here really where it does cut across exactly those two agendas. You know, the RPP has a really small focus, a very good focus on where we come together as health, local authority and third sector on children's, but the PSB has got the early years. It's all linked in, and if we get the early years right, that will help us with our police, with our fire, with everything we're doing, because it is all, so that early years pathway, having that focus as a region and doing more on that together, it's hard because it cuts across. So we find it hard just to get those principles agreed, as an example, but actually I've just come from the suicide workshop this morning, actually, and we had all the partners there across our region. It was really, really good, and it really shows how some really good things we could do connected up. But a lot of it was starting with parents and families and communities. That's where some of the solutions and leadership is, I suppose, needed. Yeah.
Absolutely, fully agree with that, Karen. Thank you. Stephen?
Yeah, thanks. And just looking through the community safety aspect, in fairness, I echo what everybody says, particularly identifying the gaps and the overlaps. So the CSP aspect for us, as we got the 2 CSP partnerships, then the 2 service boards, etc. Obviously, Neath, Swansea. We're just trying to get everything aligned up between us because it's the same team for myself that's operating in both areas. Our new commissioner has just rewritten her plan, and then we have to take out, as part of the national CSP reviews across the UK, taking cognizance of those objectives within the CSP. So within the Step 5 update, we placed comments in there. We're reviewing the objectives for the Swansea CSP to make it a little bit more streamlined. And I think there's going to be some overlaps with the stronger communities objective here, particularly around that community cohesion aspect, because I can see the Save the Swansea partnership doing some work, engaging, responding, particularly with our most diverse communities, and just to make sure it's all aligned and not duplicated. So I can see that's been picked up in the report as well.
Great, thank you. Ness, did you want to come back with any comments?
No, I'm just grateful for the support around the room, and I think we will try and get sort of formal endorsement of the way forward from each of the partners, and then we can start to focus on kind of the implementation and prioritize some of those recommendations and really work through what's required to make them happen. And I think the key point that Abby and Marie were making is, let's make sure our agenda items are are clear as to which board is doing what, so that everybody in all our organisations understands that too. So there's a comms piece as well around ensuring that our officers understand that this is where we do the mental health. That's the partnership we're doing mental health services in, and this is where we're doing early years, for example, where we can without creating even more silos.
Yeah, as I said, at the start of this item, really critically important piece of work, and could, help us to operate in a far more logical, sensible approach, and work closer together. So really appreciate the work you've put into this, Ness. So I can't see any further questioners. So we'll move on to item 7, walking in our shoes. Howell, did you want to come in on the last item?
Yeah,
or?
just in terms of discussion on the health partnership, the role of the public service board, I'm conscious it's an issue that exists across many PSBs. And I was just wondering, has a bigger review been done about those overlaps amongst the roles of different boards and so forth? Is the Wellbeing Commissioner, I thought they were going to look at those roles. So I'm just trying to think, do we wait for that? I can't remember the timelines, but do we wait for that to report and then take things forward? I just welcome people's views. Sorry, it's just something I just recall reading and not quite remembering all the details. Apologies.
Yeah, I'll call Ness in, Howell, but I'm never envious of NRW having to sit on 22 PSBs, for example. It's not easy, is it? So I appreciate where the question is coming from.
Yeah, Roger and myself, but like a tag team with some of us, Roger. So
Ness?
Yeah, so it's something which is periodically done by Welsh Government, usually in response to people like us saying this is all too complicated, can't we streamline it? And the kind of the response is you can make arrangements at a local level to do, or regional level to merge boards or to do the type of work that we're doing. To align the governance structures. So I think, rather than wait for them to amend the partnership landscape, because I don't think that's coming anytime soon, we need to focus on how do we make the best of what we have at the moment. And, we know that some PSBs across Wales have merged. So, in some parts of Wales, there are more than 3 counties in one PSB. But the view that we have taken to date is we have a merged PSB for some specific subject areas, like our substance misuse, which works really well. But actually looking at our area plan and where we are with it, I think we drew a conclusion that merging wholesale wasn't appropriate at this point, although that's something which we may want to look at as we get to the next iteration of our area of our wellbeing plan in a couple of years' time. Thanks,
Ness. Roger?
Yeah, thanks, Chair, and thanks, Ness, for the background. I think just for those, perhaps, some of us go back a long way with this. We have tried in the past, I think, because a lot of the themes we had, particularly with Neath, Talbot, were very closely aligned. But there wasn't an appetite by the same, because once you merge, you can't unmerge under the legislation. So, and I know Ness makes reference. Gwent, I believe, are one PSB now, and there's and a couple in the north as well, I understand as well. So
yeah, they are.
Yeah. We have come together, as Ness alluded to, in and around suicide prevention and county lines and like as well. So we have brought sort of collective issues, collaborative issues, and where we join forces. So there has been some good work in that space previously, but yeah, I'd love to have my PSB attendance as I'm sure other partners, but yeah, it's very comfortable as well, I think, and in some cases there are nuanced differences between the two areas, and I think the nervousness in around Neath Talbot would be the sense of being perhaps swallowed up, and I think that's perhaps the nervousness, and that's just a view rather than a fact. So, but yeah, thanks, Chair.
Thank you, Roger. Howell?
Yeah, thanks, Roger. I think just I've been doing some review work across Wales from LW's representation, and even where many of the public service boards have merged, then the kind of subgroups, the work underneath, are still continuing very much as a county basis. So the first sight, you think, oh yes, it's great, but the one thing I've discovered is that the objectives set under each PSB, especially around the environmental portfolio, is still being done at a county level rather than at the PSB level. So just to throw that in the ring, just for people's awareness, because obviously it may not be quite the efficiency as that we think may be derived at the outset. And I agree with Roger's comments around, once you do merge, it's very difficult to go back to previous arrangements. And I think similar discussions have happened around Carmarthenshire, Swansea, Carmarthenshire, Pembrokeshire and Ceredigion, is all kind of stayed as it is for now. Diolch.
Thank you, Howell. And just to note Karen's comment in the chat that the Wellbeing Future Generations Commissioner report is due out soon, and will recommend a review of current structures. So it's good we're thinking about this already. Absolutely agree with that, Karen. Okay, I can't see anyone else indicating on this item. So we'll move on to item 7, walking in our shoes with a verbal update. Apologies, who is taking this verbal update?
I think, Chair, it was for a discussion about who's going to do the next one and when. So
yeah, I think, Karen, if I'm not mistaken, did we say that Health were going to do the next event, or am I remembering it completely incorrectly?
I'm not sure, actually, Chair.
I think Howell's put his hand up. There's
I
always
think
good to have a volunteer.
Yeah, I think, Andrea, it is down with ourselves. Unfortunately, we haven't progressed matters due to internal changes, and but yeah, happy to organise something. But just need a date really. Would May time work with people? What are people's views around that? And a rough agenda item from our side was be maybe start off in our lab in Singleton, Swansea. That does all our water quality monitoring across Wales, and then we can do a bit of work outside around water quality and focus around that and some of the estate management. That's my initial thoughts, but unfortunately we haven't got the exciting toys that the fire service has to offer. But that's as good as it gets from NW. But unless Abigail has an alternative offering, maybe we can deliver something sooner.
I can see a lot of nods on screen. Roger?
Yeah, I was going to say, if Karen or Abigail offer, it's going to be walking in your flip-flops, given your backdrop today, your pictures behind you. Not so much walking in your shoes, but yeah.
I'm still catching up here, so I'm not entirely clear, Chair,
right,
what walking in our shoes is. I'd interpret it as something different, so I'm just catching up. Is it a bit of show and tell?
Yeah,
would it be helpful
if I give a bit of clarity, Abigail, just what that event is? So the first one, we've only had one event so far, and that was kindly hosted by Mid and West Wales Fire and Rescue Service. And it was all the board members were invited to the fire services to find out more about operationally how the fire service works. And it was a really interesting event, actually. And, you know, talking about the challenges that the service faces, being spread over such a large geographical area. So it's about us as partners finding more in more detail, finding out about the partners, how you operate as an organisation, what your challenges are, what the potential opportunities are. And I think we literally are walking in your shoes. For example, if we came to the health board, we'd stay with you probably for the day, and you know, just to find out a bit more about how the organisation works. So hopefully that clarifies, and I'll bring Roger in because he was the one who actually introduced this to the board as something that we could look at. And the first one was extremely successful, which Roger hosted. So Roger, I'll hand over to you to come in with a bit more information.
Yeah, thanks, Chair. And I think just for Abigail's and Marie probably just we ran it down in our training centre, which is the end of Fabian Way, Earlswood, Jersey Marine, that sort of area, and quite a large site. But we also use the opportunity, not, you know, operationally, obviously, we have, you know, sole sort of control over that, but there are other areas where we really do touch into partners, prevention work, a lot of community engagement, safeguarding. We talked about some of the issues we've identified. We have safe and well visits. Now, we used to do just sort of home fire safety, you know, checks, very quite sort of, you know, put up detectors and check overloaded sockets, but we now do sort of, you know, home security, things like scamming or smoking cessation. So we identify issues and not do the work, but signpost into other agencies to put far more sort of, you know, once we cross the threshold and as a sort of trusted partner and respected in the sort of community, we can't use the word exploit, but we make the most of that opportunity, I suppose, to come into people's homes and to get a key message across. And the second one was around our protection work, which is around our statutory excuse me, turn my phone off. Our statute did in around inspections of commercial premises. So we brought teams from building control in from Swansea, and, you know, the great work that obviously work together in terms of pre-consultation work on new builds or, you know, significant refurbishments and that sort of thing. So there's a great opportunity, I think, to align some of the work that we do and for a mutual understanding as well. So this, you know, it went better, I think, than we thought. It was a really great opportunity, some great links and networks built up as well around that. So
thank you, Roger. Okay, so Howell, we will look forward to the invitation and finding about more about NRW. So thank you for that. So we'll move on then to item 8, which is the Public Services Board Annual Report 2024-25. Ness, are you taking this item?
Yeah, really, it's just to remind members that we will be writing a report for this financial year 24-25. Ideally, I would like to be able to bring a draft of that report to the next formal board meeting, which is in April, on April the 10th, rather than wait until the next one, which is in September. So we will draft the report based on the updates provided in this meeting, with further input from the strategic leads. And I propose to bring an initial draft to the informal board for discussion on the 17th of March. The question for the board, I guess, is this year when we did the 23-24 report, we also did a video. And so some reflections from the board as to whether we want to repeat that as a way of improving accessibility to the report, and if so, we need to sort of put that work in train.
Thank you, Ness. That seems very straightforward. Any questions on this item? So we look forward to working on this in the future meetings. So item 9 is for information only. The feedback letter received from the Scrutiny Programme Committee and the response, but I will open it up. Does anyone have any questions on this? No, just, you know, it was a really positive meeting. I know Roger and myself attended, and it's good to see the direction of travel from the Scrutiny Programme Committee as to how they note the good progress that we're making as a board, which is really comforting to hear. Ness?
Yes, just to say for colleagues to note that the committee did say that they might be asking other statutory partners to attend the next scrutiny session. So perhaps, Leanne, if we could just send the date to the statutory partner representatives, just to hold that in your diary in case you are invited to attend. But they were really complimentary about the progress that the board is making, so it's a positive session.
Thank you, Ness. Roger?
Yeah, thanks, Chair. And I think just a heads up, I suppose, for stats partners who do attend. Some of the questions previously I've been around, the classic PS, this would have happened anyway type sort of questions. That's and what are the tangible, what are the milestones, what are the measurables, what are the metrics around it? You can imagine this sort of thing. So, which hence I think certainly within our plan now, a lot of those have been realigned, and we've got things we can actually show and do and say and talk about. And on that note as well, just I've tried to flip it around the scrutiny committee to say, where we have these events, please come and have a look. I invited them into the Swansea.com stadium for our targeted prevention workshops. We didn't have a great attendance, if I'm honest, but I think we need to, get them to triangulate the information we put into the scrutiny committee and say, well, actually, let's see it firsthand and talk to people and get some of that detail back as well. So I think we, put it back on them a little bit to say, come and see it, invite them in if we're doing, even if it's a walking in your shoes event, if one or two could attend that, and just get the feel of sort of, organisations coming together and identifying opportunities for working more collaboratively. I think that'd be helpful as well. So yeah, thanks, Chair.
Yeah, thanks, Roger. And I completely agree. I think there is definitely added value for scrutiny committee members to come to our events to find out more about what the PSB does. So completely concur with that. Okay, so the date of the next meeting is Thursday, the 10th of April at 3 p.m. for noting. And it just remains for me to say thank you to all of you for your contributions today, but also the incredible amount of work which is going on in the background. Very much appreciated. And we look forward to working closely with you moving forward. Great to meet you, Abigail and Marie. Look forward to seeing you in the future, hopefully in person, which we tend to do with our informal meetings. So look forward to seeing you there. And just to say, diolch yn fawr, thank you very much. Have a great rest of your day. Thank you.
Thanks very much.
Diolch yn fawr, Cadeirydd. Thank you, Chair.